Welcome to this week's edition of Public Health Updates, covering the latest breakthroughs. Brought to you by Lucid Quest. A 72-week clinical trial has confirmed that Mounjaro is significantly more effective than Wegovy for weight loss. Participants taking Mounjaro lost an average of 20% of their body weight, compared to 14% for those on Wegovy. Furthermore, 32% of Mounjaro users lost at least 25% of their body weight, versus only 16% of Wegovy users. Mounjaro also led to greater waist circumference reduction, 18 centimeters compared to 13, and showed better overall metabolic improvements. Experts attributed superiority to its dual action mechanism, targeting two distinct brain pathways involved in appetite regulation. New research from Switzerland has found that Semaglutide, a GLP-1 weight loss drug, may improve mental health outcomes. The study linked the drug to enhanced mood in individuals, both with and without pre-existing psychiatric conditions. Its anti-inflammatory effects may reduce neuroinflammation, contributing to improved well-being. Results suggest the drug is effective and safe for those with schizophrenia, bipolar disorder, or major depressive disorder. With over 2 million people receiving care through the NHS mental health services, this discovery could offer widespread benefits. Scientists are developing a new class of inverse vaccines that retrain the immune system to ignore harmless proteins. Using nanoparticle technology, these vaccines showed promising results in early trials. In a celiac disease trial, the approach prevented intestinal damage, and in mice, it halted the progression of multiple sclerosis. Unlike traditional immunosuppressants, inverse vaccines aim to be safer by avoiding broad immune suppression. Early human trials for celiac disease and multiple sclerosis are ongoing, with researchers optimistic about future clinical applications. The migraine medication, Ubrogepant, may be the first to treat symptoms before the headache even starts. In a phase 3 trial, the drug alleviated premonitory migraine symptoms, such as fatigue and dizziness, within 1 to 4 hours. This represents a shift in migraine treatment strategy, from reacting to pain to proactively managing early symptoms. If further validated, this could change how clinicians approach full-spectrum migraine care. Spending too much time sitting has been linked to increased risk of Alzheimer's disease. In a 7-year longitudinal study, prolonged sedentary behavior was associated with brain shrinkage and cognitive decline. The association remained even in participants who exercised regularly, suggesting that physical activity may not fully offset the risks of excessive sitting. Individuals with the APOE4 gene, a known risk factor for Alzheimer's, were particularly affected. Experts recommend incorporating more movement throughout the day to support long-term brain health. A new wearable device offers real-time estimates of breast milk intake by measuring electrical signals during feeding. In early trials, the device estimated milk volume within just 2 milliliters of actual intake. This non-invasive tool could offer parents peace of mind without the need for cumbersome pumping or lab-based measurement. Although larger trials are still needed before widespread clinical adoption, the technology holds promise for enhancing infant nutrition tracking. Men face significantly higher mortality rates from takotsubo cardiomyopathy, commonly known as broken heart syndrome, according to U.S. hospital data. While 11% of male patients died during hospitalization, only 5% of female patients did. The condition is more frequently triggered by physical stress in men, while emotional stress is a more common trigger in women. Experts suggest that biological factors and differences in social support networks may contribute to this disparity. There is currently no proven medication. However, rapid medical attention for chest pain remains critical. New research has identified taurine as a key energy source fueling leukemia progression. Leukemia cells extract taurine directly from the bone marrow to meet their energy needs. In lab studies involving mice and human samples, blocking taurine uptake significantly slowed disease progression. These findings raise concerns for cancer patients consuming energy drinks, which often contain high levels of taurine. Future therapies may focus on inhibiting taurine transporters to starve leukemia cells and slow the disease. Stay ahead in public health research. Like, share, and subscribe for weekly updates. Visit lqventures.com or email us at